So I'll let Claire get started, and she'll tell you about her. Claire.
Thank you very much. Can you get the slides up for me? Well, we don't know what the numbers mean. IBCS. I don't think that's us, no. Try that one. Yeah, that's fine, lovely. Very good. Welcome everybody, and thanks very much to Aaron for that introduction. I just wanted to talk a little bit about the Vision 2020 links programs that are run between the UK and between mostly sub-Saharan African countries. One thing that makes me feel that the world has come of age when National Geographic on the front page has as its main leader article that there is the end of blindness. Finally, visual loss and blindness has become a political issue, and that's wonderful. Vision 2020 is about universal eye health and ensuring that everybody has what they need to prevent or cure or rehabilitate vision. Remembering that 82% of blind people are elderly, and that the cure and alleviation of blindness contributes to the alleviation of poverty. And this is because if you have a blind person in the family, then usually there is a child who's not receiving an education in order to look after the blind person or another adult. And so if you have people who would be economically active not being so, the family is much poorer than it would be. We started the program in 2010. We got a grant from our government, and it's part of East Africa College of Ophthalmologists and the Royal College of Ophthalmologists. So that's now COEXA and the RCOP. And our aims were to improve areas in pediatrics, glaucoma, medical retina, and nursing. We've had many visits, in fact many more than 4, to the UK and many more than 4 to Uganda. The demographics, it's a little bit like India, but perhaps more so. The mean age is 17 years, average number of babies per woman is 5, and retinoblastomas, they have 80 a year with a population of 36 million. The country is the same size as Britain, and only 10% of the population are over the age of 50. Most of the eye conditions can be dealt with at primary level. There are 31 districts, and it has 1 ophthalmic officer and 1 eye-trained nurse in each of the districts. And this gives you an idea about where Uganda is, and it's just on the shores of Lake Victoria, squashed between Kenya and the DRC. And these are lessons that we can learn from particularly India. Alleviating blindness is not the same problem as alleviating blindness in India, because India is naturally very much more organized. The people expect to work very hard, and also well-educated population. So the issues are different, but they're similar. It's worse there. We now have a global action plan to improve vision by 2020. And I recommend anybody to have a look at that. It's the World Health Organization. And it's by equitable health education system, more eye doctors, more OCOs, more eye nurses, more eye healthcare workers. We are also involved with the Diabetic Retinopathy Network, which is the DRNet, and we have 15 hospitals a catchment of 3.8 million with diabetes, and it's supported by the Ministries of Health, and the emphasis is on capacity building. So the overall rate of diabetes is 2 to 3%, which I think here in India you would laugh at. And you'd say, what, only 2 to 3% of the adult population with diabetes, but it is growing faster in sub-Saharan Africa than in anywhere else in the world. They also have a curious type of malnutrition diabetes and a ketone-prone diabetes, which is possibly related to cyanide toxicity from cassava. Hypertension is much commoner in sub-Saharan Africa, and it's extremely difficult to control. And this, of course, makes all the problems of diabetes much worse. This gives you the sort of percentages around Africa, and you'll see that Uganda has about 1.5% of the adult population with diabetes. There are many systemic reviews which show that of the population surveys, proliferative retinopathy is about 1% of those with diabetes, maculopathy between 3%, and other ones come up with similar sorts of figures. So what are the barriers to an effective service? Patients don't attend clinics easily. They don't attend clinics for all sorts of good reasons, is that they're difficult to get to. They haven't got the cost of the transport. There is a low doctor-to-patient ratio with short consultation times and no or virtually no patient education. There's a low level of trained nurses and other workers, and there's very little systematic evaluation and monitoring of the complications. Poor records, and we need the national policies to be on board in sub-Saharan Africa. There's also a lack of ophthalmologists and a low number of those with training and experience in diabetes, because a lot of them may have a good ophthalmic education but not know how to do a laser. There are few optometrists, and there's very poor and difficult referral from primary to secondary care. And there's a lack of systematic screening. In August, we did a community eye care, and you'll see that I was wearing the same dress there, and it's not the only dress I have in hot countries, but almost. And we are now running community eye clinics, and we're doing an education program to increase the number of community eye clinics so that the difficulties of getting to where the doctors are, to where the patients are who are blind, to where the doctors are, which is mostly in Kampala. It's a recognized problem by the Department of Health, thank goodness, so we're training them to use the fundus camera, the eye care, arc light, and automated fundus detector. And we're doing a series of clinics this year, three of them. And we're training 10 to cascade the outreach program. I'm not sure if any of you are familiar with the arc light. This is it. It is a direct microscope. It is a magnifying loop. It has a blue light, and it has color detection, visual fields, and it's powered solar. Costs £5, and with that we reckon we can populate most of sub-Saharan Africa. If you haven't seen it yet, it's really worthwhile, and I can recommend that all trainees and all medical students are equipped with an arc light because it's cheap and it works. Sorry? No, it's difficult to get them at the moment. As soon as they've made the next batch, it'll come up onto the website. And that's us doing a nice portable camera, arc light, ARC light, yes. Lead Forward program, we've run 3 days of workshops, three lots of leadership programs, and they was to the nurses and doctors, eye care workers in Kampala. And they said that it was really useful because they felt much more competent at facilitating meetings and at giving quality improvement, which is really well needed. And this is our first group of doctors and nurses. There is also the ICO Leadership Development Programme, which is run by the African Ophthalmological Council and the ICO, American Academy. And in India, it's run by the APAO. And this is here says what it consists of, but it's basically a 2-year program with 1 day at the APAO, get a self-initiated project, mid-term 2 to 3 day program, and a graduation the following year with presentation of the projects. And that's the website. If you think of one outstanding, fairly young ophthalmologist who would benefit from this, can I suggest that you apply to them on that website, because it's a very useful program. Just like to acknowledge the photographer who also runs our program in Uganda, which is Terry Cooper, and there's a couple of his pictures.